What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Doing wonderful. Hey, everybody. Thanks again for listening to us. Any questions or any topics that you want us to talk about at some future date, please let us know. Just email us, make comments on the site. But thanks again for supporting us and finding the information that we're putting out useful.
Yeah, absolutely. And tell a friend, because there are chances that today's topic is going to relate to someone you know. So we're talking kind of about achy knees and this misnomer. I don't know if you've ever heard, Keoni, but don't let your knees go over your toes when you're squatting, lunging, or something like that. Avoid knees over toes like positions, right? Have you heard that before?
I've heard that so many times, right? Like
Right.
in the gym, like never let your knees go over your toes. Like I guess they say it puts too much strain on there, but I don't know. I always kind of question that, but
Well, you're right to question it, because anything like that, and that's a good point. Anything where it's like avoid these positions or avoid this or don't do this with your body, and it's more or less naturally intended for your body to do, right? Like your knees are intended to bend, and people are telling you don't let them bend to a certain degree because they'll start going over your feet. And we know with our body, especially me as a physical therapist, I like to drive home to my patients, my clients, that there is almost nothing that I'm going to ask you to specifically avoid, barring like an immediate active injury that we're working through at that time. And so that kind of relates to this knee thing. And it's a misnomer that I've pushed before as a personal trainer, and keeping the knee safe. And you want to try and avoid some of those further degrees of knee flexion is what we're thinking when we suggest, hey, don't let those knees go over toes. You're trying to decrease the amount of stress that goes through some of those knee structures, like specifically the ACL, the patellofemoral joint. And so let's just start there. What does happen when we go knees over toes? So anytime we're increasing our knee flexion, we're obviously putting more stress through that tibiofemoral joint, which is where the tibia, which is the lower leg bone, and the femur, which is the upper leg bone, meet. And then there's also another joint within the knee called the patellofemoral joint, and the patella is your kneecap. So we're thinking between the femur and the kneecap is a joint, and we also have that femur and tibia joint. Primarily when we go knees over toes, or we go into more knee flexion, we are putting more pressure and stress and compression through the patellofemoral joint, so that kneecap joint. Can you hear me, Keoni? Because I saw your lips move, but I didn't hear you.
yeah, I can hear you fine.
Okay, sorry.
Yeah, I was just agreeing with you. Like when you go into flexion, like I'm thinking about like a yoga sitting position, right? You're in extreme flexion at that point.
Yeah.
Right, where you're sitting, where your butt is back on your heels.
Yeah,
and
absolutely.
So that patellofemoral joint, the tendons and ligaments, like a band that's getting significantly stretched. I actually like sitting in that position. It feels really good on my knees. So
nice.
So awesome. I always kind of question, like that's an extreme example of taking your knees way beyond your toes, right?
Yeah, it definitely is. It definitely is. And we do know that patellofemoral joint is where primarily, like when you're in that position, Keoni, that's where the majority of that stress or compression force is being applied. That's the biggest joint that's dealing with kind of like the most changes. There are specific structures like the ACL that may undergo more stress at specific points of the range of motion, right? But as you increase your knee flexion, in general, you're increasing the compression of that patellofemoral joint, that kneecap joint. And so as personal trainers, physical therapists, doctors, all over the place, we're trying to keep things safe, obviously, and going knees over toes is not doing knees over toes is limiting the amount of compression and stress some of these structures are going through. So that could be a good thing. It could be a bad thing, right? In my case, what I'm going to argue is that the rule of never letting your knees go over toes is just completely wrong. And I can provide many examples in your day-to-day life where you're going knees over toes. And that kind of points back to what I was saying at the very beginning. I'm never going to suggest anything that's super common, natural. Your knees go over toes when you walk down the stairs. Like when you descend, go down a staircase,
Yeah, it's
your
a
knees are
functional
going over
movement.
toes. Yes. When you go and you bend all the way down to grab a laundry basket from the floor, your knees are going over your toes. If you reverse walk at all, your knees are going over your toes. So just like you said, Keoni, this is a very functional movement. This is something we're doing in our day-to-day lives. Thus, it's not something that we should start avoiding. As a matter of fact, it's something we probably should strengthen because it's something we're very often doing.
Well, so did that whole kind of come about from adding weight to your back, or using dumbbells and squatting with weight, where that becomes an issue? I mean, I guess if you're putting more weight on your back and you're going into extreme knee flexion, that can be a problem, right? I mean, is that where it's coming from? That's what I'm wondering. But on the same hand, it's also training you. It's stressing your knee, as long as you don't overdo it, that whole joint, to be more functional.
Right, right. So I would argue that, and now we're just, why is this demonized over time? I would argue people in general, people often have poor biomechanics. So the more that they go into these knees over toes positions, they're feeling that compression. And sometimes that compression doesn't necessarily feel good because they don't have great biomechanics. We do know, hey, we are putting more stress through some of these structures, but it's a great point that you just mentioned. We go to the gym to stress ourselves, to get stronger, better, heal, get faster, all this good stuff. And that is exactly where I want to kind of draw the line on, obviously, why we should train knees over toes like positions. Because if you're descending the stairs, you're going knees over toes positions. And I've had plenty of patients who come to me and say, oh, my doctor told me never, ever squat past 90. Avoid as much knee flexion as I possibly can because that really hurts. And this is something I could, I have really bone on bone knees. So the doctor told me to never do, past 90 or let my knees go over toes sort of things.
In essence, yeah, just sit there for the rest of your life
and get
and
weaker,
don't do anything.
and never address these areas that maybe they're painful because they already are weak. And that's why when you bend down to 90, you start to feel that pain and discomfort under the patellofemoral joint. And then if we think about like with Wolff's Law, and we talked about going to the gym, we work out, we stress ourselves to get stronger. So Wolff's Law is specific to bone. And Wolff's Law states that more bone is laid down in areas where there is more stress to that bone. So you have osteoblast and osteoclast. Osteoblast build bone, osteoclast kind of reabsorb bone and help take up old, not as healthy bone cells to lay down stronger bone. A good example that you can feel on yourself of this, if you feel your kneecap and then you just kind of run down your leg to your tibial tuberosity or your patellar tendon, and you feel that bump right on the front of your shin, and you feel that big, thick, bony prominence. That is kind of an example in every of your anatomy of Wolff's Law taking place. That little bony prominence that, the tibial tuberosity, where the patellar tendon attaches right on top of your tibia. So if you're just feeling your shin right after the knee, that's what you're feeling. The reason that little thing is so built up and you have that ridge is because of Wolff's Law. The patellar tendon is attaching there. It's constantly pulling on there. And so the body goes, hey, we need to lay more bone down here so it can be pulled on and not be bothered. So we know that's to get stronger. And we know that's 100% a rule or kind of a philosophy for bone health. And there's no reason why we shouldn't assume that transfers over to other things, connective tissue, muscle. And we know for sure, muscle, we can go to the gym, we can stress, we can take time off. The muscle will get stronger and be able to produce more force. It'll be able to stabilize us better and things like that. So I would,
and we talked about this on our osteoporosis podcast. You get stronger with muscle, you're building bone.
Yes.
Right. I mean, so if you build your strength, you're building bone. So strength training is one of those things for a bone building exercise program you want to do.
Right. So if we take that same philosophy and we apply it to, okay, you were a 50, 60-year-old person, the doctor said, man, look at your look at your x-ray. You are bone on bone, which is my favorite thing, because every bone should be bone on bone. I would hope to God that they're connecting bone to bone, like, as they should. That's where the joints are.
So what are they saying? What are they actually saying? Are they basically saying there's no cartilage or padding there?
Yeah, that's with when your doctor, when they're specifically talking about your knees and they're going, man, this is bone on bone. They're talking about a lack of cartilage, a degenerated meniscus, just a little, not as much. What they're trying to say is that your bone is directly on top of the bone, but it's just, that is the case. And it's also not the case, right? We have synovial fluid. We have a lot of things in there, and being bone on bone is not a death sentence to painful knees. Every bone, every joint is bone on bone. And it's just,
right.
The way they go about saying it to someone, they learn their bone on bone. They know that they shouldn't been past 90. And now all of a sudden they have these non-functional knees. And so we need to kind of flip that script, because like we just talked about with the gym there, if we are not going past 90 or going knees over toes, and that was painful for you to begin with, how the hell are you ever going to get strong enough for that not to be painful? Right. So we need to go knees over toes to strengthen that knees over toes position and make our knees a little less cranky. And that's relating to that Wolff's Law. There is a chondromyalgia is a thing that can happen to soft tissue or connective tissue. So chondromyalgia very commonly happens to the patella, the kneecap, on the back of the kneecap. And what that chondromyalgia means, what that word means, is there's a softening, kind of like a degeneration in terms of it's not being used, and it's softening the cartilage underneath the patella. So then you can imagine going knees over toes when we're compressing that joint and it's real soft, it's not strong and resilient to deal with those forces, it can be pretty painful. So my argument here is you need to incorporate this knees over toes training, because it is a functional pattern, and anyone that is telling you don't go knees over toes is wrong, so long as you're not actively recovering from, ACL, total knee, fill in the blank, surgery, or very serious injury. The day-to-day person really needs to be strengthening and training this knees over toes position. So,
and what are those positions then? Like, what are those things that they can do at home? Because that's what we're talking about in general, right? We're not specifically talking about the gym where you're trying to keep your biomechanics correct with weight on your back and stuff, right? I mean, I guess we're talking about both, but
yeah, we're talking about both. And what we're talking about is, in reality, so we're thinking of, and we're using the knee, but this does apply to all kind of joints, right? And that's where I go back to what I was saying earlier. I'm never going to say as a physical therapist, oh, you should not, avoid bending your knee as much as you can, barring you have some sort of immediate surgery or limitation that we're concerned with right now. And the reasoning for that is, we know moving a joint through its full range of motion really helps aid the longevity of that joint, aid the synovial fluid, the actual joint structure stay nice and healthy. So we want to do that with the knee. But to answer your
not
question,
only that, Bryan, not only that, you think if you're using the full range of motion of your joints, especially your knees and your hips and stuff, you're also likely decreasing your risk of fracture, because you're becoming more coordinated with those full range of motion movements. It's like, if you go through the full range of motion with your joints, then it seems like you're more likely to catch yourself in a fall. You're less likely also to break a bone. You're less likely to injure yourself also, I would think.
And for a myriad of reasons, right? Some of that would be Wolff's Law. If I'm training knees over toes, then I have strengthened the bone, and I'm inferring, this is not scientifically backed, but boy, do we know we can go to the gym and strengthen tissues. And so I'm inferring Wolff's Law can be applied to these deeper levels of a joint range of motion to strengthen the structures around it. The joint structure, the capsule, all the ligaments and tendons at their end ranges, when they're having that amount of stress, and then they get time to recover, they will strengthen. And that's what I'm arguing. But the point of, how do we do this, right? So when I talk to someone and they're 65 years old, their doctor told them they would never bend past 90 again. They're bone on bone. They certainly need a total knee replacement on the right, and they'll definitely need one in 5 years on the left, type of thing. I hear this all the damn time. And what we need to start doing is rehabbing this joint surface. And that includes the joint surface, the muscles, and it just takes a comprehensive approach. But that person comes to me, they're in pain, they've been told all these things. And what's the first order of business? So the first order of business is to get the joint moving in a pain-free range as much as possible. So we're going to start talking like specifics here. So let's just say you have cranky knees. You're one of these people that want to try this knees over toes positioning thing. A lunge is a great way to start that. So we're just going to use a lunge as our example throughout here. So let's say you're standing fully upright and you go about 30 degrees of bending your knee, and that's completely pain-free. Hang out in that 30 degrees of knee bending for an isometric amount of time, 5-10 seconds or so, to work on the stability and stress that pain-free range in that position. So if we're hanging out in that slightly lunge position, your quad.
So we're in a static lunge right now.
Yes, we're in a static lunge. All the muscles are working to hold you in a nice, coordinated, stable fashion. The ligaments, the tendons, the connective tissues of the knee are being stressed at whatever 30 degrees of stress is for them, and they're constantly isometrically maintaining that stress. And then you come out of it and you can go back into it and do it for reps like you would any other exercise to get stronger, but it be completely pain-free. Now, with that same person, let's say we've been stuck at this 30 degrees of knee bending and we want to start to get past 90. And after 90 is when it began to be painful. So we know with joints, we want to move it through the full range. The best way and the least painful way in general to move through full range is passively, meaning, Keoni, I would grab your knee and I would bend it for you as much as I can without that being pain-free. Repetitively bending your knee is going to help move that synovial fluid, stimulate those glycosaminoglycans, GAGs for short, and proteoglycans, PGs. Those compounds love water, so they attract water to the joint, and then we start rehabbing this joint surface. Nonetheless, we're working it out with some of this lunge type stuff, or you actively using your muscles and you're getting blood flow. So now we've got food, we're healing the area, we're lubricating the area, and the passive range of motion is great for lubricating it because it's super easy to do in a pain-free range best we can because you don't have much load going through your body. But let's say you don't have me. What's the next step? Or what's the next best thing? The next best thing is active assist range of motion, which means there's something sort of helping you. And the way we're going to use this here is it's not going to help you get into the range of motion. It's going to help take weight off of you in those deeper ranges of motion. So again, using our lunge concept, Keoni, we're thinking about a lunge. Let's say we're in a position where we're got a chin-up bar above us and we can hang like a resistance band or over that chin-up bar. We're going to get into the resistance band. So put the resistance band underneath our shoulders. So it's off weighting us, right? Similar to like the effect you would get if you did this in a pool.
Okay.
And so as you go, if we do this and we've got the resistance band around our shoulders and it's pulling us up, the deeper you go into that lunge position, the less weight your knee is actually dealing with. And so that way, let's say you're this 30-degree knee painful person, you can ease into 45 degrees with less weight and just work. And let's say 45 degrees is your pain-free range, right? Work your way to that 45 degrees with that active assist, and then slowly continue to increase that range as long as it's pain-free with that assistance by off-weighting your body in some way.
Yeah, that's a great idea.
Does that make sense? And it can be done in a pool. There's a lot of ways to do it. You can, if you are, even if you're just at home or like me in an apartment complex, you can stop by the stairs and hold the two rails and use that to off weight yourself. But what you're doing
squatting yourself.
You're squatting yourself. You're doing the exercise, but you took the added benefit of off weighting yourself. Let's say you weigh 170 pounds. And you've taken 50 pounds off, and you're actually taking, with the band example, more weight off the deeper you go, right? So it's really helping you go through this range, develop the ability to go through this range pain-free, and then we can slowly start to load it and strengthen, because you'll be able to go through those ranges, hold it in a pain-free position, and then we can slowly increase that range that is pain-free. So that's what I would really suggest starting with if you're one of the people that this really speaks to. You know, if your knees are really cranky, if going upstairs makes your knees speak out to you, if, you know, when you bend down to grab an object off the floor and your knees are really speaking out to you, I would argue you really need to start doing some of this knees over toes training to strengthen the muscles and the connective tissue of the knee that's going to help provide stability and pain-free range of motion as you move through this.
Yeah, it's a great idea. I already have a couple of patients in mind that I need to do that with. Some of the people that I train.
Yeah. And the biggest thing is you want to do it through a pain-free range, right? So you never want to blast through pain or keep pushing into pain. I'm not one of those. I'm not a trainer or physical therapist who says the no pain, no gain moniker. That is not my thing at all. And so with this, everything I'm talking about needs to be in a pain-free range. And I don't care if that's, 10 degrees of knee bending for you. You can off weight yourself and you can slowly, and you will notice, let's say it's that 10 or 30 degrees. If you do those lunges, let's say you do 3 sets of 10, holding the lunge position for 5 seconds at the bottom, that static lunge, and then come back up and come right back down into them, all within the pain-free range. In a few weeks, you will certainly notice your ability to go deeper and deeper into that level of knee flexion.
Right. And in a few weeks, you'll even notice your patients will say, yeah, going up and down stairs is not as painful. I mean, you'll notice Precisely. That almost right away if you do it appropriately. So let me get this straight. You are actually talking about, I mean, you use this as your stereotypical patient. Here's your patient, goes into the doctor's office, having severe knee pain. Doctor says, well, they do the imaging and they basically say, well, you have no cartilage in your knees. You are bone on bone. So essentially, then the physician's telling you, well, we have to do some sort of surgery, because that's the main thing I hear. You have bone on bone. That's the recommendation. You need surgery. Now, I've had a number of my patients who have bone on bone, have been told that, right? Mm-hmm. Were pushed to surgery and basically, exercise or did whatever and just did not want surgery. They were terrified of surgery. And this would be 10, 20 years out and they still have their knees without a knee replacement that was recommended to them. So it to me, it just speaks that you do have some time to do something about your knees, or at the very least stave off knee replacement. And I don't know about you, Bryan, but from what I've seen, as far as the surgeries go, knee replacement seems to be one of those where it's iffy. I mean, some of my patients are great. Some of my patients come out of there and they're worse. Mm-hmm. I mean, what experience with that?
Yeah, I mean, in general, just as a physical therapist, I would say 75% of the people get out of their total knee replacement ends up going pretty well. But that other 25%, I have seen horror stories. Like, I mean, the worst outcome. Like, this is way worse than it was.
Right. But either way. So we have bone on bone. We're talking about knee stuff there. Whether you get the surgery or not, you still are going to want to do stuff like this anyway, right?
1,000%. Because when let's say it is a total knee replacement, they resurface the joint, they maybe resurface the patella. That doesn't solve any of this muscle connective tissue. It doesn't do anything for that. And as a matter of fact, the good news is you probably got your knee replacement at 55 or 60, so it should last, type of thing. But your connective tissue, the soft tissue of your body, is still not going to be adept for you to safely and typically, like you will, go knees over toes in these positions. And you're just going to continually set yourself up in these bad biomechanics. Now, it's
Right.
obviously a very different thing if you've had a total knee replacement, because hopefully you're coming out of surgery and bending your knee, after you've healed and everything like that is not painful because everything's completely resurfaced and in theory it's perfect.
Okay.
So,
Yeah.
it for me, who this is, this is for that person you just broke down, like the person who's maybe thinking, who went to the doctor, has been told that, and is thinking I have to get a total knee replacement, or has been told, hey, this is inevitable in 5 years, sort of thing, which it definitely is not. And then I'm also thinking of people like me, young teenagers, 20, 30, 40. Imagine how much less ACL tears and like patellofemoral pain syndrome, which is really common
Yeah.
in young adolescent teenage women. Um, all that could be avoided if we do some continual strengthening and like these isometrically lunged positions to allow Wolf's Law and all these other areas where it's not called Wolf's Law to take effect and make these areas stronger. Nonetheless, you know this, Keoni, if you're holding an isometric thing for a while, especially a functional position like a lunge, you're getting a lot of really good stability challenge, like your hips, your lower back, your knee, in particular, your ankle. All of this stuff is really working overtime to maintain those good biomechanics. And that is going to correlate to the field or the functional movement and whatnot. So everyone can utilize this. So if you're, 28 and you have cranky knees, this is a great way to start. If you're 67, I've taught people this split squat that I'm going to talk about a little bit that has started to develop more knee bending. We have a mutual friend, Keoni, that's someone I keep thinking about for this. And she was one of those people that the doctor told her, hey, you should never squat past 90. And it's like, well, why do you think the knee hurts every time you squat past 90 or walk up the stairs? Because you are going past 90 to walk up or down the stairs.
Right.
And you've never once trained for it. Meanwhile, you want to do a pull-up, you train exactly for a pull-up, but we don't train the knees in the same way. And as a matter of fact, it's been demonized because of a lack of knowledge on all of our parts, and I'm guilty of it too. And it's not appropriate. And of course, there is a time and a place where it is appropriate to really watch that knee over toe positioning, like a few weeks, like with staples, obviously, of like a total knee replacement, and obviously easing into that range of motion. So there is a time and a place for it, but the general everyday person needs to be training these knees over toes position, and it will help your knees be less cranky. And I'm arguing that it will strengthen everything around the knee. We know about Wolf's Law. We know we can work out muscles and make them stronger. And I'm going to argue that we can do the same thing to increase the tensile resistance of like the ACL, the retinaculum, which is a piece of connective tissue that crosses over the knee, and like the meniscus and things like that.
I want to put a plug in for our episode 171. That's where we talked to Dr. Eli Locke, right?
Mm-hmm.
And I think he was talking about PRP?
He did talk about PRP. Mm-hmm.
Yeah, and he was specifically talking about, I remember him talking about using it on knees, like achy knees, and people that had like, we're trying to avoid surgery and getting pretty good results with that. Anyway, check that one out, episode 171.
Yeah, and that type of treatment would go phenomenal in conjunction with this type of workout regimen or this type of therapy, because then the PRP is providing the food that you need to get to where you want to be and heal how you want to heal. And then you need to go through the range to strengthen it, to Wolf's Law, to stress it, to stimulate growth and resistance that it will build up.
Yeah, and PRP, just so you guys know, is platelet-rich plasma, I think, right? Is that, and they're inject. I from what I understand, they inject that into the knees. I have some colleagues who do that, and it stimulates some healing, and it really helps the knee. From some of my patients that it really be much more functional and decreases the pain. Whereas, some of the treatments that were certainly promoted and still are in the past really could do, if you do it too much, could do some damage. So I'm talking specifically of steroid injections into the knee just to like mask the pain, which over time can cause problems for the knee. I would imagine it'd be less problematic if you're actually training the knee though, if you're getting that, right?
And that's a great point, because so what we do know about these repeated cortisone injections or steroid injections is they do degrade the quality of your connective tissues and like the surfaces of your joints, making you more bone on bone, heaven forbid. And so
right.
using, the philosophy and the things I've kind of, the dots I've crossed today to come to this conclusion, we do want to strengthen that and go through that so we can improve it, or else there will be
Right.
no improving it. I mean, we know we go to the gym to get stronger, and if our knees are painful as we walk up the stairs, we need to strengthen them. Now, it may be some other things that are happening that are making that pain come through. And of course, that's where I can help you directly. But overall, on a day-to-day basis, the average person, knees over toes is completely safe. Certain people, there's a guy I just want to shout out. He's known as the knees over toes guy online. Ben Patrick, I think is his name. Athletic Truth Group is his like gym business or his personal training programs. He is all about knees over toes. And if you are looking for more, you can really listen to him. He has a couple studies he points to, and he also is a big proponent that this knees over toes training made him more athletic than ever. He argues that he could never dunk a basketball prior to performing like knees over toes, split squats and things like that. And now he can dunk a basketball is his argument. And we can think
That's
about
cool.
that.
But
Yeah, and we
that's
can think
neat.
about that in terms of like the vastus medialis, which is a quad muscle in the center. Really, he's arguing it's really important for that knees over toes, explosive type of jump movement. And you really strengthen that in a deeper knee flexion lunge type position. You also really strengthen the hips. You can get a really good strengthen or a stretch to the, if you're doing a lunge, the leg that's behind you, get a really good stretch to those hip flexors while you're holding that 10-second isometric lunge. So it has a lot of benefits to it that I really do love. His exercise called the ATG split squat. And there's like a million videos online of him kind of explaining it and talking about it. But what it is it's a way to begin this knees over toes training in a pain-free way and really begin to get that knee really far forward over the toes.
So when we're talking about split squat, are we talking about the stereotypical lunge? Is that what describe a split squat to me? I'm not sure what I know what that is.
Split squat, more so just putting one foot behind you on a bench or stable surface, and you're doing a lunge.
Right. Yeah, you're doing a lunge.
Don't have that other leg.
Right.
And you could do either, right? There's there's differences between the two, of course, but both would go really well in a comprehensive program to strengthen your knee, whether you're lunging, in a lunge type position or a split squat. But he does have that ATG split squat I would really recommend looking up. And it's a great way to start. And again, maintaining that pain-free thing.
What's his name again?
Ben Patrick.
Ben Patrick. Okay.
Knees over toes. Literally, knees over toes guy is how he's known. And that's really it, Keoni. The biggest things I want people to know, and we'll do another podcast on this, kind of similar to this one, where it's just kind of like a philosophy that I've developed, where motion is lotion, and we want to talk about that and in more detail. But motion is lotion, and thus we want to move our joints through their full range. We want to be strong through the full range, because it's when we are not strong through these full ranges where we do possibly set ourselves up for injury, or poor biomechanics, faulty mechanics that possibly lead to injury or more areas of pain. And going through something like knees over toes in a pain-free range and strengthening it will allow you to work around achy knees and rehab them and actually get them better, and not live in this death sentence of never let your knees go over toes and you're bone on bone. We'll see you in 10 years for your replacement type thing.
Right. Yeah. Well, just a plug for you, Bryan. I mean, I have had a number of my patients that I referred to you who just and did not have the hands-on experience with you being there, right, in the room with them, and so mostly like Zoom calls or the phone, from what I understand, and significantly help think differently about body mechanics. And I as I have a couple groups I train, do outdoor training and indoor training, and it's significantly helped them with being more functional with their movements. So also check out you, Bryan, like get in touch with you. And especially with the knee stuff. I actually have another person in mind where they're thinking about knee surgery, which I think they would benefit from just doing a brief consult with you.
Yeah, absolutely. So if you want to find me, I'm B.Well Physical Therapy and Wellness, B.Well PT. BWellPTFL.com is the website's in the show notes if you want to chat with me directly. But I do want to shout out, Keoni, our virtual surgery episode too, because this is very prominent for this discussion as well. And I think I can't remember exactly who you were referring to, but I can talk about my mother-in-law. She had a total knee replacement on one side, and then she is under this category of, the doctor told her, hey, this other one's bone on bone. Good God, how do you even walk, lady? Like, we'll chop it up in 5 years when you can't walk anymore. And it's like, good God, thank you for instilling confidence in people and making sure that they know that they can heal themselves and the body's naturally adept to work through this. And we just have to follow a plan. And she's one of those people where we've started getting this knees over toes training done. And she had chronic, to walk, knees were painful to walk.
Yeah.
So you can really, before considering surgery, listen to that virtual surgery episode. And there is
it's episode 192.
192.
Episode 192.
And in short, if you do something physical that can relieve or cause your pain, that's a really good sign that a physical therapist or some sort of musculoskeletal health professional can get you out of that problem. Because there's a direct correlation, a direct cause versus a direct cause and a direct way we can take it away. So there's something wrong there that we can piece together much better than snipping it out and just taking it completely out of the equation or changing something super drastically with surgery. And the big way is just real quick review. Do these split squats, do knees over toes training. There's a variety of ways to do it. Passive range of motion you can do on yourself. So you can just be seated and trying to bend and kind of windshield wiper the knee from flexion to extension within a pain-free range to lubricate that joint. That's a very pain-free way to do it. You're not getting as much strength because there's not resistance or you're not standing or in that example. And then that next step is that active assisted range of motion. And for this example, we're using that as a means of unweighting our body. And unweighting our body can allow you to creep deeper into those knee flexion degrees with less pain, and then work on stabilizing those pain-free ranges, and then you can improve that. And then, of course, we can get to active range of motion where it's just body weight. You're going pain-free all the way. And then obviously, as you get stronger and stronger, adding some weight to that, which would really help you get that knee over toe, because we know any extra weight is going to make it a little easier for you to sit into a lunge or sit into a squat, right? That way it's going to help kind of sit you down and ease into the position so long as you can control it. And so that's the order you would want to work through and start with this. And then there's a variety of videos. If you just look up knees over toes guy, and he talks all about it. I've got some videos on YouTube. The biggest thing I want you to know from this podcast, use your joints, move your joints. They're meant to be moved. The more we move them through their full range, the more we keep the health and the integrity of the joint as a whole. And then if we strengthen around that, we're setting ourselves up for really good long-term joint health.
Right. And the less you're going to have other issues like falls and fractures and, so on and so on. That's related to all of that stuff. Balance issues.
And think about the person who has been told, that person who it's painful to bend their knees past 30 degrees. And they trip going up the stairs and their knees at 70 degrees, and they need that level of knee flexion and the quad, the hamstring, the glutes to work to stop them from falling, but they have not gone past 30 in a couple months. It's not going to work, right? They're not ready for the demand of that. And we want to be ready for these demands.
Right. Right. Which sounds like it would put you a lot worse off if you're not ready for those demands.
Yeah. So give it a try. The most important thing is everything starts pain-free. If you're having any pain at all, don't hesitate to reach out to me, but regress it in some way. Pain-free is the most important thing, and staying aware of the positioning and what you should be feeling and the type of alignment that you want in like a lunge position and things like that, which is a different podcast in itself. But my point is, use your joints, use them to the fullest, and you can strengthen joints to, I believe you can strengthen joints to be more resilient to specific postures.
Oh yeah, no doubt about that.
Anything else?
All right, well,
Keoni?
thank you. No, that's it. I mean, that was wonderful. It's giving me some ideas for my patients and my clients in the gym. So
Yeah, if you like this type of episode, let me know, because this is one where I'm just kind of on a soapbox here versus using a bunch of research and things like that to back me up. And it's kind of things that I've seen now in clinic for a few years and in practice that I'm starting to kind of form, some of my own ideas that don't, that are in conjunction with a textbook, but we know those textbooks are written 20, 30 years ago by the time they get to me. And so I definitely want to do one on the motion is lotion philosophy and really let people know why it is a good thing to move. Nine times out of 10, when you're in pain, moving will help. And we'll have to talk about that in the future.
Absolutely.
All right, Keoni. Well, until next week or next time, everybody, we will talk with you then. Until then, be well.
See you, everybody. Thanks.